Hello, my name is Matt Bird, and welcome to the PublishU Podcast, where we explore the real life stories of authors from around the world. Today, I'm absolutely delighted to be joined by Janahan Famaratan from Dubai in the UAE, who has written an incredible book called Health Care Next. Janahan, welcome.
Thank you. Thanks, Matt.
So tell us about you. People that are listening, watching, know nothing about you. Give us a little insight into who you are and what you do.
Okay. So I am. We live in Dubai, in the UAE, and we've been here for the past 6 years. I'm a father of three, and husband. And from a work perspective, I've been a management consultant most of my career. From a hobby perspective, I spend most of my time with kids, being the young kids that they are, age 11, 6, and
Who's the youngest kid in the family then, Janahan? Is it you?
it is with my Lego toys and everything else that I that I work with. So yeah, so it's I we live in Dubai. We kind of, and I work a lot across the region, across the GCC, between the UAE, KSA, Qatar, Kuwait, everywhere, and been in healthcare for most of my career. So not as a doctor, but on the other side of the equation, working with hospitals and healthcare systems.
Making the organization and the systems work.
Organizations, technology, policies, governance, financing, across a whole bunch of remits for how healthcare works across the country.
Amazing. And Dubai has many reputations, but one of the reputations it has is for a phenomenal standard of medical care and provision, some of the best in the world.
Indeed, indeed, and it is leading in many ways. And the advantage that the region in general has had is it's hasn't had the history that a number of other Western countries have had within this. So they have the opportunity to leapfrog across a bunch of things that they have had. And that's kind of a part of the insight in terms of how my book and the relevance comes to the wider audience on this.
Amazing. So you've written a book, and we'll come to that more in a moment, but I'm really interested. When did you first think, oh, maybe I want to write a book?
When you call me, Matt.
When you call me. It's amazing how many people say that.
So it's when you dropped a message. As in, it's what from a background from my background, I grew up in science. So I did my master's and my postgrad within physics and mathematics, and then afterwards then sort of wandered into the area of consulting. But I do have an academic background, so I do tend to do a lot of writing, researching, publishing on my own right. But that's whether it's writing deliverables or work for my clients, or whether publishing through articles. So I've been doing this for a while, but the concept of bringing that all together in a book hadn't quite crossed my mind. I even thought whether it was doable or possible in my mind. However, after our conversations that we've had, that let's give it a go, see how it kind of evolves. And if anything, there's a process of writing the book, but the process itself has been very beneficial to me, more so than the output of the book itself.
Yeah, but there's the book. But I always find that for people in business like you and I, actually writing about what we do adds a layer of clarity of thought that isn't there when it just sits in your head and your heart. But writing it down somehow brings a 2020 vision to our thoughts.
It does, and often when you put down pen to paper, lots of magic happens, right? Whether you're journaling, whether you're writing, that clarity of thought comes in. However, it is trying to pull together. For me, the biggest challenge has been in writing the book, and the biggest opportunity off the back of that is writing one article is interesting. But having multiple chapters in a book are like weaving together a story across multiple chapters and multiple articles together. So how can I do that while still engaging the readers and getting them bought into the scenario within this? That's been an interesting learning journey for me as to how who do I write for and how do I engage them?
Yeah, because as you said, you're used to writing articles and
Indeed.
papers and documents, but actually a string of those as chapters into one cohesive story is interesting. What if you said I mean, beyond that, if you said there was an obstacle that you faced and overcame in writing, what was it, Janahan?
The initial obstacle was just getting myself started because I when you write articles, and I do read a lot of books, as you can see in the background. Have lots of books on the shelf, and I'm constantly going through two or three books on a regular basis within that. And it's always been one of these things where it's only very experienced senior authors that could write something, but can I write something that is publishable and others could read? And what you do find is when you do speak to a number of people, everybody values your point of view. Whatever it is, the book is a way of generating a conversation. So no matter who reads it, you write the book and then get the conversation out there. So the first step in getting started, getting over your mental hurdles, is the most interesting, is the most difficult thing. And of course, the next thing is getting it completed, because you have deadlines. You need to kind of get things closed. And being the academic and scientist that I am, you always have this strive for perfection, that you need to
Mm.
get everything down to the T. It's like, you know what? Just get the message out. It will evolve over time. What is that 80-20 rule that you would need to adopt to be able to do that? I think that's the next hurdle that I had in terms of closing the book down.
So, how did the writing my book journey help you, Janahan, that we did together with a small cohort of others?
It was interesting. I think that the putting together, giving a structure to the process was very helpful in
Mm.
terms of starting up with what's your inspiration, what's your BCP, what's your outline. You do your brainstorming work, and then you then figure out how your narrative fits in together. So that structure was very helpful in terms of getting it started. And I think much like I use the term flywheel in my book quite a bit, because when you use a flywheel, the first couple of turns is always the most difficult. And
Yeah.
when you get those flywheels, the first couple of turns going, then things become a lot easier. So the initial part of the process was exactly what was needed to get the flywheel turning. Once the flywheel is turning, then sort of stuff comes out of your head, and then you write within it. So the structure was very helpful. The process was very helpful. And to some extent, having a group a group that you work with who are in a similar situation where they haven't
Mm.
written anything before, if so it's different kinds of book. That was very good in terms of brainstorming, sharing ideas with, to be able to get something down on paper.
Yeah, and of course you got it. You got the job done, as you get every job done. So congratulations, well done. And now the
Thank you.
book's out there. So let's get into the heart of the book. What is the core message of your book, Janahan?
The term AI is used a lot in the market these days, in whichever industry that you want to use. And that's quite relevant within healthcare, where you're delivering care to individuals in the front line. And healthcare is one of these things where you cannot afford to get things wrong when you deliver care. However, the people running healthcare systems are healthcare professionals and healthcare managers. They are not AI experts.
Mm.
So my with my experience and my kind of conversation that I've had with this so far, this book was meant to be is meant to be a playbook that healthcare operational leaders can use to understand how and where does AI come to relevance for them, and how can they use it in real life, not abstract teachings, not theoretical conversations, but what does it mean in terms of your day-to-day job and how you
Mm.
can implement it. And
Mm.
that's the main theme behind it: implementation, day-to-day job.
Mm. And that's amazing because so much of the stuff you hear and read about AI somehow exists up there in the stratosphere beyond our day-to-day reality. So your book bringing it down to the practical day-to-day in the context of healthcare is really, really powerful. And I know you used a clever little device. There's a character who we follow through your book. Tell us about this character.
So the origins of the character came from my initial confusion as to how can I weave together multiple chapters together and make it sound interesting that will keep a reader with me through the entire process. And when I was looking at various ways for doing this, inspired by various books that I've read within this, I thought about how about if I think about a reader of mine actually being part of the book, being
Mm,
part of the story within this. So I brought in the character of Samantha, who is a operational director within the NHS in the UK, and how she would go about her day-to-day journey of grappling with AI within the job and her roles that she has. In addition to that, she is not just a practitioner. She is also a daughter of a mother is who has Alzheimer's and a number of conditions that she's having to deal with as a daughter as well. So how is
mm,
she able to both work with healthcare AI as a practitioner and as a carer within the health system as well? So
mm,
using that theme across the entire book felt like a good way of bringing to life
mm,
the narrative, the lessons learned, and what I would like people to take away from reading the book.
Beautiful. Very clever, but very, very powerful and practical, which is what I love. So, can you give us, Janahan, one example of a practical reality that Samantha faced, in the day to day, or one you might imagine her facing, and how AI was able to help her?
Yeah. One of the things that she has always grappled with, and we all grapple with, more so in the UK than in the Middle East, is the fact that all of our healthcare data is held across a number of different systems. So if you have certain laboratory results, certain scans, certain doctors' notes, um, I've I've seen, experienced a number of it where people often write down on a piece of paper in a booklet, here is my list of medications that I take. Here is my results of my previous scans. Here are what the diagnosis that the doctor is telling me. And people go around the place with this handwritten notebook with a whole bunch of pieces of paper printed out on it, and they give this book to the doctor when they go see the doctor. And this is what Samantha does. And she works within the NHS. So she works as an operational leader within the NHS. So that is the real scenario in terms of what she's facing. The opposite view of the spectrum is she has a whole bunch of technology vendors and other individuals who come to her saying, oh, you know what, there's this blue sky out there that these systems automatically talk to each other, they give you these results, they give you these insights. And she is dealing with this diametric situation where she's having to carry around a handwritten piece of handwritten notebook, while at the same time she's being preached to about the realities of what this would be. And part of the story in this and in the midsection of the book is how do you reconcile these two realities? How do you make sure that they converge? And what are the questions? And how does Samantha deal with this on a day-to-day basis to be able to get to the reality that she wants it to be?
Amazing. Brilliant. I'm looking forward to having a physical copy of your book. Of course, I've seen the manuscript, but I'm looking forward to having mine, and it's going to go on the shelf, as all the PublishU books do, on the shelf in my holiday home in Italy. And I'm sure
Fantastic.
anybody that's medically minded is going to pick up your book, or even somebody who has someone who they're caring for within a health system. It's really, really powerful what you've done. Thank you. And two closing questions that kind of interrelate, really, Janahan. One is, what do you hope is the impact of your book on the reader?
Asking better questions. So, what are the right questions that you need to ask? In order for you to ask the right questions, you need to be informed. Get away from the jargon, take away this cloud like persona that AI has, understand what it means, but then asking the right question. What are the right questions to ask? How do you, in order to get to the answer, answers often are the easier part of the
Yeah.
equation within that. Asking the right questions are the most difficult part. So I'm hoping that this book helps people to ask the right questions to be able to understand how AI impacts what they do on a day-to-day perspective.
Brilliant. And the related question actually is turning it around full circle and saying, what is it you hope the book does for you?
Now that's an interesting question. Um, the the slight detour on this. As I was getting through the manuscript, getting people to look through it and provide some acknowledgements, comments within that, whether it's Dr. Lorenz who provided the forward, or whether it's Duncan Selby who provided the comments behind it, within that, the moment people saw the narrative and how it all came together through using Samantha, it's almost like the light bulb clicked for them in terms of how they they can use it and how they can use their teams to use it as well. So in terms of what will this mean to me, part of my own view is how can I give something back? Give something back to an industry that has given me a lot from a personal perspective, from a career perspective. But then the other part about it is how can we engage in a dialogue to demystify AI in a more practical sense. So this book is the first of, I'm hoping, first of many books that will come out. This one intended for operational leaders. Next one intended for senior leaders, and there's a whole series of them that I'm thinking through. And I'm hoping that this sort of starts up this dialogue, and I become part. I enable a movement within this dialogue in whatever small shape or fashion that I can do from what I do.
Beautiful. I love that. Thank you, Janahan, for joining us today. And thank you all for listening to the PublishU podcast, featuring the real life stories of authors from around the world. If you're interested in becoming an author like Janahan, then please visit our website, www.publishu.com, publishu.com. And if you enjoyed this broadcast, make sure you subscribe for more. Goodbye for now.